This episode of Community Updates is brought to you by the Cody Country Chamber of Commerce, promoting the last and best of the West. Here in Wyoming, we've experienced far less impact from the actual COVID-19 illness. We have the social distancing, we've seen our friends and neighbors scale back or even shut down their businesses, but very few people are actually ill from the virus. Dr. Billin is the Park County Health Officer and was able to give us some updates today as to what's really happening from a medical and societal perspective.
You just got off of a phone call with the Cam Shawley, the superintendent of Yellowstone National Park. What did you learn?
Basically, what Superintendent Shawley said was they have a definite plan for opening, and it's going to be a gradual plan. It's going to be a stepwise plan. It's going to be data-driven rather than date-driven, but they don't know yet when that plan will be implemented. It's just too early to tell.
All right. Well, that's at least good information right there. At least we've heard from them, and that's important. Tell me a little bit. As of today, we've got was it 313 cases? What are we looking at for numbers right now?
I believe we have 313 cases in the county. Those cases are usually announced about 1 o'clock, 2 o'clock, sometimes 3 o'clock every day, and we're seeing an increase of a few cases. Only 2 deaths. I'm sorry, I said 313 in the county. It's 313 in the state. 2 deaths in the state that are COVID-19 related. And we've had 2 cases diagnosed at West Park Hospital in Park County. One was a Park County resident who has recovered, completed quarantine, is doing extremely well. The second is a Bighorn County resident who had returned to Bighorn County to home and is under quarantine there now.
Now, we have had a remarkable lack of cases, lack of illnesses here in Park County. To what do you attribute that?
Well, I think it's a couple of things. When the talk was first going around about states issuing shutdown and stay at home and shelter in place orders, Senator Barrasso went on and he talked about how Wyoming has been social distancing for 100 years. And I think that's very true. The fact that we're a rural state means that we have social distancing built in. We are definitely very different from hotspots like New York, New Jersey, New Orleans, Detroit, and Chicago, in that we are rural, that we have different based economies. But I also think a lot of what we've seen is in response to what we've done to flatten the curve. What we've done early, and we had a 2-week head start before coronavirus got here over New York, but what we did made a difference, and we're seeing the fruits of our labors now.
Now, there's been a lot of concern about personal protective equipment. How are we sitting right now in Park County for PPEs?
I'm on the staff at the Powell Valley Hospital. I'm in touch with the other hospital regularly. And one of the things that they have foremost on their list is make sure that they are adequately supplied for PPE, personal protective equipment. And the recommendation has been that N95 masks, which are designed to keep things out, and regular surgical masks, which are designed to keep things in, that these be reserved for medical facilities and healthcare providers. But the CDC has now made a recommendation, that was about 2 weeks ago, that people do wear some type of face covering when they go out in public, especially when social distancing is hard to maintain. From what we're hearing, both hospitals are appropriately conserving their PPE. They're in good shape. We have people in both communities making large amounts of homemade masks. They're not as effective as medical grade masks, but they are helpful. And those have been delivered to both hospitals.
That's excellent. Now, there's been a lot of protests, quite a few of them over the weekend, from people who they're concerned. They're like, let us open up, let us go back to work, let us open our businesses, let us send our kids back to school. What is the medical response, the public health response to that, particularly here in Park County?
I've done a lot of my information on social media lately, and I am seeing also an increase in frustration and impatience with the measures that are being put in place. And this is perfectly understandable, but people have to realize that if we act too soon, we will see a very quick resurgence of the coronavirus. We also are in a county whose economy is based upon tourism, especially coming out of Yellowstone Park. We have to make sure that not only can we take care of our own, that before we see increases in tourists in the next couple of months, that we're able to take care of those that come to visit our county. So it is important to realize that that a data-driven approach is much more important than a date-driven approach saying open now.
And then what can you tell people who have these feelings of restlessness, who say, we don't have a lot going on here, we don't have the issue? What can you, how can you assure them that we're doing the right thing by staying home?
It's hard to assure them. We use many years of experience, education. Everything that we do is data driven. And there have been no recommendations that I have given that I don't have a scientific study saved on my computer as a PDF that backs that up. Everything we do and recommended is data driven. I've had people tell me, I don't believe in your science, but I think Neil Tyson deGrasse said, the funny thing about science, it's true whether you believe in it or not.
You use a lot of social media. You're very active on social media, and I think that that is really reaching a lot of people. What has been your experience with the response from social media?
I think the experience has been really good. What I did is I've taken posts on my personal Facebook page and shared them with 10 different Facebook pages that people frequent throughout the county. Classified pages, chit chat pages, things like that, pages set up for communities. And it proved to be a easy way to quickly reach the majority of the people in the county. And it's just to inform them. And people will notice that I very rarely voice opinion, and I usually just give facts and keep people updated. And when this began, I was seeing maybe 1% people who were in opposition to what's being done. Over the last couple of weeks, that has grown. And I have noticed increasing frustration and restlessness with this, but it's proven to be a viable vehicle to get the information out. It's just one way we're using with the incident management team for the county. We're also using radio, the Bighorn Radio Network on Speak Your Piece probably about 5 times now. We're using newspapers in regular touch with the print media. I last Friday went around and got 15 businesses in town to commit to using their reader boards out on the street, their electronic marquees, to help get public health messages out. Wash your hands, stay home if you're sick. And the good thing is the vast majority of the county and the community is still behind us. But we need to remind people it's not over yet. We need to hold the line. This pandemic and our response in Wyoming and Park County has been a great education for me. There's a lot of things I've learned in the process. And I think one thing we found that at the very beginning of an outbreak, when you're working in the containment phase, when you don't have a lot of cases in your county or in your state, testing can be very effective. Unfortunately, testing is very hard to come by these days. It's limited at the state level, limited at the national level. When there is evidence of widespread community transmission, testing would still be good to do, but it becomes less critical. What becomes critical is social distancing. People need to stay home no matter what virus they have, so that that virus burns out and ends with them and is not shared with others. We've seen a lot of influenza, RSV, adenovirus, rhinovirus, and other things going around this winter. Right now, the predominance is the coronavirus, the COVID-19. So I think we need to keep getting this message out that there's different kinds of testing. For instance, polymerase chain reaction testing, or PCR testing, is what we call a molecular test. It looks for evidence of the RNA or DNA of the virus directly. It detects the viral presence itself. It's the best test for diagnosis. It has an inherent laboratory rate of about a 5% false negatives, but when you take it out of the laboratory into the real world and start using it on people, you introduce so many levels of potential error that in reality, the false negative rate has been estimated more in the 20 to 30% range in many communities across the country.
Wow.
So we have to realize no test is perfect. And there are people that we're very convinced had coronavirus or COVID-19, yet their test was negative. Now, the only numbers that are reported are those who had positive tests. We have to realize that the real number of cases is much bigger than the numbers we're seeing. People ask a lot about antibody tests. Antibody tests direct antibodies that your immune system makes in response to the virus. There's some problems with antibody tests. There's about 90 antibody tests made or are available in the United States right now. About half of them are made in China. Not too many people are trusting China right now, but only 3 of them are approved by the FDA. And those are under emergency use authorizations. So no test is approved through the normal FDA process. So there's concerns about their accuracy. Some of these tests cross-react with other coronaviruses that cause the common cold. We all get the cold. And so we may see a lot of false positives due to colds that we've had recently. So antibody testing is not terribly accurate yet. It's coming. It's not locally available. We wish it was available. We wish we could use it, but we think it will be a very important part in the aftermath of the pandemic, sorting out who's had it, who's not, who can go back to work, who still needs the social distance. Unfortunately, it's just not as available as we'd like it to be right now.
That's understandable. One more question then, Dr. Billin. What have we learned through all of this that we'll be able to apply after the pandemic phase, I guess, is over? Are there things that you are able to say, you know what, we learned from this, let's apply this to this and this?
Well, we live in a very interesting society. We tend to live in clusters, except for, of course, here in Wyoming. We live here because we like to live out in the country. We like to do things our way. But the world is such a place that high population centers have seen outbreaks of pandemics and epidemics from time to time. There was the Black Plague during the Dark Ages. There was the influenza in 1918, the Spanish flu, which came in 3 waves. And the second wave was the worst and killed millions of people across the globe. So one thing that we've learned is we've been reminded that our industrialized social society is prone to this from time to time. And this is a reminder that invisible microbes that can do this are out there, and they will do it from time to time. If you look back, we've had the H1N1 flu, we've had the Spanish flu, we've had MERS, we've had SARS, we've had Ebola. About every 4 or 5 years, there's another infectious agent that's a threat to us. We need to learn these lessons, and we need to change the way we behave. And I think this has been the worst pandemic or epidemic that we've seen in quite some time, probably since 1918 and the Spanish flu. And we need to learn the lessons about washing our hands, covering our mouths when we cough, about social distancing, about getting our vaccinations, and all those other things that go into good hygiene.
That's perfect. Dr. Billin, anything else you'd like to tell local folks as well as statewide people who have concerns who will see this?
Well, a lot of people, the question burning in their minds is, when will we see the peak? There's a lot of models out there that predict when the peak will come. But we watch the models, and models aren't so much to predict the future, they're to help us make decisions to be prepared for the future. They tell us what could happen. And so we haven't relied upon any one model. We aren't giving a date that we think that we're going to see the peak. We have to realize that models are like the GPS in your car. It gives you an ETA when you're going to arrive at your destination. If you speed up, the ETA gets closer. If you slow down, the ETA gets farther away. And like GPSs, models are most accurate when you've arrived at your destination. So they have limited use. So on a statewide level, what the Wyoming Department of Health is watching for is a decrease in the number of new diagnoses, a decrease in the hospitalizations. And we see that trend when it is persistent for a short while, then we'll know we're over the hump and we're on the backside of this. But people have to remember something about bell curves. The slope on the way up is just like the slope on the way down. We can't just flip the light switch on and this be done. We have to back out of this cautiously, just like we got into it.
That's perfect. Dr. Billin, thank you so much for your time today. I sure appreciate it.
Okay, glad to be with you, Wendy. Thank you for your time.
Thanks for tuning in to another community update. The Cody Country Chamber of Commerce thanks you for caring about your community. To find out how the Chamber can help your business, contact Tina Hobel-Heinrich at 307-587-2777 or go to their website at codychamber.org. If your business would be interested in sponsoring these conversations with local community leaders, please contact me at 307-899-2799 or email me, Wendy@wanderwyoming.com.